Hello, this is Bernard Tan, and today I'm with Mr. Chow Han Wei, a chiropractor. We are going to talk about our project that is going on, which is Wellness for Pianists. So it's a project in collaboration, between a pianist and also chiropractor. So Han Wei, I want to ask you, what makes you feel interested to collaborate in a project like this?
So I myself is an amateur guitarist. So sometimes in the past when I practice, I do realize that occasionally I do get some discomfort. And then I get taught how to set up properly while playing, but aside from that, there's not much information regarding what should I do if I do get some discomfort when I practice, back pain, my forearm gets sore, what to do, where to find information. So once I realized that, I noticed that there's a gap in knowledge and awareness amongst musicians. So likely, based on the combination of my knowledge as an amateur guitarist as well as a chiropractor, want to look into how I can help other musicians regarding this problem.
Yeah, because from my experience as a pianist as well, I feel like this branch between playing techniques and also physical wellness is kind of starting to get there, but it's just quite a recent kind of development.
Yeah. Agree.
Yeah, so we previously did an assessment for a few pianists who signed up to this program. I did assessment on piano technique side of things, and then Han Wei on the physical side of things. So what were the observations from you from that session?
So from my side, during the day, the assessment, I think people that presented, the findings are quite consistent with what we've read in the research and studies. So pianists mainly gets issues in the wrist, hand, elbow, shoulder, as well as the spine. So spine including your neck as well as the lower back. So fairly consistent with what we can read up in the research. So similar presentations.
Yeah, actually, what could be the issue? Because when we talk about piano playing, we always think that it's all the hands or just something to do with the hand and the fingers, but it actually affects the spine and the back as well.
Yeah, our understanding would be kind of like a repetitive strain injury, where you need to be spending long hours holding a similar posture and then repeat movements again and again. So it is quite common or understandable to get discomfort like this, especially if you practice long hours and are not aware of how to look after yourself.
Yeah. So when we know about actually the anatomy of the hands, the wrist, it's actually quite complicated, right?
Yes.
How our hands actually works, and I read that there are 7 bones or 9 bones in the wrist.
Yes.
So can you explain just briefly how complicated this our playing mechanism is, and what are the common injuries that can occur from that?
Okay, so yeah, I mean the arm, lots of muscles, lots of nerves. So the wrist is designed to be very mobile, so hence the carpal bones we call it, so the floating bones. It gives you a lot of flexibility, and then connecting them will be a lot of tendons and that comes from the forearm. So and then obviously links to the shoulder and the spine. So any issues from any part of these can cause discomfort. So common injuries that we find in terms of the wrist and hands, so being a lot of tendons, a term called tenosynovitis, which is the swelling of the tendon as well as the sheath surrounding it, most of the time due to repetitive side movements. Also tendonitis, so tendonitis is actually the irritation of the tendon itself, so that can happen in the forearm. Also another forms we see is any kind of joint dysfunction and muscle strain. So any joint that has been subjected to uneven stress, they can start to get restricted. Also the muscles can get tired, subsequently they can get injured, so that can be a source of pain and discomfort as well. Lastly, another common one is nerve entrapment. So nerve entrapment, a very popular one being carpal tunnel syndrome, which most people will know. So it can cause numbness, tingling in your arms. So these are the common conditions that we may see.
I see. Yeah, sounds like very quite a few different kind of injuries.
Yeah, so wide range, but a lot of them have a common theme, is what we call repetitive strain injuries. It's just overuse, so need to be aware of how to prevent them in the first place.
I see. Yeah, so actually from my understanding, going through piano pedagogy, understandings of different school of thoughts, and especially towards the recent years where piano pedagogy kind of shifts a little bit towards the biomechanics of playing and the body awareness. So there's one term that keeps coming up that is presented as a very common cause of injuries is co-contraction, and that's what a lot of pianists feel as well. Especially we always feel it in the forearms. So it's like after playing maybe more difficult, complicated passages, it's very sore around the forearms. And seems like it's co-contraction that is happening. Can you explain what this is actually?
Okay, so my understanding of co-contraction, I think with a lot of the other activities and sports, would be a simultaneous engagement of what we call agonist and antagonist muscle. So agonist being the muscle that's actually performing the intended movement, and the antagonist being the opposite one. So the muscles will fire together as in co-contraction. The point of it, or the purpose of it, is to increase the stability of your joint, as well as increase or improve accuracy of movements. So obviously, if you are playing a complicated piece, a lot of coordinated movements, you will want the joint to be able to be stable and also be able to be more accurate to press the keys that you want to. But obviously, excessive co-contraction can cause too much pressure on the joints and muscles, and subsequently can lead to pain and discomfort. So what we want is we want the minimum amount of stress and pressure to perform what you need to perform. So obviously there are steps that we can help or do to improve that.
Yeah, because you mentioned accuracy that from my experience, at least when I was playing something very complicated, right? And when I'm thinking about I need to hit the right note, and sometimes I do tense up. The feeling of tensing up probably is that co-contraction feeling. But of course, technically we can actually use different ways to improve accuracy, not necessarily. I think that's probably something of a kind of a human reflex kind of thing.
I think that happens with many activities and sports as well. I mean, like with every other sports or athletes, same with pianists, you want to use the least amount of stress on your body to achieve what you need to achieve. So obviously, if having better playing technique can reduce co-contraction stress, definitely can work on that.
Yeah, so it's the efficiency of the
efficiency of movements, exactly. Yeah.
Great. Any other points that you want to highlight for
so
any audience?
From a chiropractor's point of view, I think the next would be main factors that can lead to playing-related musculoskeletal discomfort, which is pain and discomfort when you play. Poor posture in the general day-to-day, not just when you're playing piano. Obviously, with poor flexibility as well, a lot of people that are not aware that they are very inflexible, that can create a lot of pressure on your body, as well as poor physical conditioning. So that means you're weak, not very strong, the body is not flexible, and obviously you don't have good awareness of posture. So all these as a chiropractor can be improved upon, and obviously having better playing techniques that should help you achieve better playing results without sacrificing your body.
Yeah, great, because that's a perfect merge of what we are trying to do here for wellness for pianists, right? So it's the body awareness, the posture, flexibility, and all those with the good, efficient, healthy piano technique, piano movements, and to be able to achieve good playing without sacrificing your body, without injuring yourself. So that's great. So that's all for our interview today. Thank you, Mr. Chow, for this. So we look forward to seeing all of you for the workshop Wellness for Pianists happening very soon.